Welcome back to Washington Journal. We're joined now by Representative Tim Moore. He's a Republican of North Carolina. He's a member of the Budget and Financial Services Committee, and he represents the 14th District. Congressman Moore, welcome to the program.
Thanks, Mimi. It's great to be with you this morning.
I want to start with health care. We're getting reporting from The Hill with the headline, Moderate House Republicans Introduce Long-Shot ACA Subsidy Extension Bill. Can you tell us about that and if you're involved in any way?
Well, a little bit of background, if it's all right. I think you have to look at Obamacare on when it passed. I guess it's been the law now, roughly 15 years or so, and healthcare costs have increased. Access has decreased in a lot of ways, and it has not helped access to health care for working families. It really just hasn't. It's been a get-rich opportunity for a lot of the insurance companies, but a lot of folks out there really are still struggling right now. And in the ACA, the Affordable Care, I think affects roughly 10% policyholders is what I understand. So it's a small population, but to that population it is important. So what I can tell you is I do believe, one, and I'll speak for me. I believe Obamacare was a mistake. I would like to see us get rid of that and go to a market-based solution that improves health care coverage, that lowers cost, and that ultimately provides better outcomes. The issue you have right now is you have, for that ACA population, that small population that's impacted by it, is that you have this deadline that is approaching right now, and trying to find a fix so that there's not a sticker shock or a cost expense to those who do qualify and who are getting it and counting on it right now. So there's sort of three camps, I guess. There's a camp you characterize, I guess, as the moderates who want to expand who want to extend the ACA. Although I think they're asking for some reforms with it as well. And then there are some who are a little more hawkish on ending the ACA, being done with it. I'm really between the two positions, frankly. I do believe that it is, we need is, I just got here. I've been here 11 months so far. So we're trying to clean up a mess that has now been in place for 15 years. And so we need to be sensible in how we go about it and make sure that we're making good decisions. So the short answer is I'm open to finding ways to continuing some kind of subsidy for a very, very limited period, with an understanding that it's going to result in this eventually going to a market-based system.
You said earlier that access to health care has decreased. And why do you think that is? I mean, you did talk about health insurance being getting more and more expensive. Why is it continuing to get more expensive?
Well, and that's the whole thing here, right? Maybe before Obamacare, health insurance was less expensive. I mean, I remember when I bought health insurance, when my family members were paying for health insurance, you could actually afford health insurance. The co-pays were more reasonable. The cost, what you actually were charged when you went to the doctor, when you went to the ER, were more reasonable. Look at the world post Obamacare. You go to the ER. I mean, I had emergency surgery a couple months ago to get my gallbladder taken out. I mean, you get this sticker shock of how much it is. Then you see all these discounts in this. There's all this, kind of smoke and mirrors in medical billing. I mean, think about this, and I'm not trying to go too far afield, but I think it's appropriate to kind of set the table on where we are on healthcare costs. Every consumer choice generally you make in your life, you know what you're getting and you know what you're paying, right? You go to the department store and you buy a pair of pants or whatever, there's a price, you pay it, you get your pants. You go to McDonald's, you order food, you pay for it, you get it. When you go for a medical procedure, most people, if they're being honest, will tell you they have no idea what they're ultimately going to have to pay. They may know about their copay, they may know about deductibles, and that sometimes that doesn't even make sense. But you go in, you show up, you don't know necessarily what you're going to pay. So the whole system needs to be reformed. So it's not just about insurance; it's about cost containment. Again, that would take up a longer show, that one subject, than we have right now,
Congressman. But there are more people that do have health care now as a result of the ACA. They at least do have access to some health care. We get a lot of calls of people on Medicare, and they love their Medicare. Do you foresee a future where we would all be able to get something like Medicare, and that there would be universal coverage for all Americans?
Well, let me say this about Medicare. Medicare is a promise that has to be kept to seniors who have paid into this system. Although Medicare it has funding issues, right? That's something that we've dealt with in the budget committee, and it's going to need reform. It's going to need boosting to make sure that seniors continue to get access to health care. The reason more people have health care is because of the aging population also, Mimi, and more people on Medicare. That's one of the big statistics. And then also in terms of how Medicaid has been expanded as well. And a lot of the Medicaid expansion, not Medicare, the Medicaid expansion has been rife with waste, fraud, and abuse, which is something that we've dealt with earlier this year. At the end of the day, there's no free lunch. I mean, these things cost money. And name me one example where government does it more efficiently with less expense in a better way than private enterprise. I would challenge you, there's not an example where that happens. But in terms of what you're talking about, if you're like the folks and the Democrats espouse this like Medicare for all, or this basically socialized medicine is what it is, single payer, that would be a travesty. There's a reason that people who live in countries that have that kind of health care come to the United States when they can to get better health care, because we're a country that believes in medical innovation. We believe in providing the best care available, and you can't have that in a completely government-run system. I mean, and look at the post office, right? The Postal Service versus FedEx versus UPS. Private enterprise does it cheaper, does it better any day of the week.
All right, and if you'd like to join our conversation with Representative Tim Moore, Republican of North Carolina, you can start calling in now. Republicans are on 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8002. Congressman, want to get your reaction to the seizure of the oil tanker, the sanctioned oil tanker off the coast of Venezuela, and your concerns for escalation.
You know, I applaud the president in taking a tough stand on Venezuela and on these drug dealers and these narco states. I've had the opportunity to visit a number of countries in South America, to meet with, I've met with folks who have left Venezuela because of the oppression and what's happening there. I've talked with law enforcement who talk about how these drugs come in, everything from, you know, our Border Patrol, ICE, you name it, ATF, agents who talk about how these things are coming in. And you have, in this case, state-sponsored distribution allowing of fentanyl and other dangerous drugs, where that government, Mimi, is allowing this toxic poison to come into our country. I mean, they're giving these guys protection. And I'm glad the president, that this president has shown the strength to actually step up and say enough is enough and deal with these guys as they are. They are like foreign terrorist organizations. They are foreign terrorist states. If you look at this, what are they doing? They're killing Americans with these illicit, illegal drugs, and they're doing it with that state's blessing. It's wrong. And I think you're going to ask about the tanker that was seized?
Yes.
Yeah, right. So again, the same thing. We had sanctions in place here in our backyard, right? It's a Western Hemisphere. You're talking, you know, just south of Puerto Rico. I mean, this is in our hemisphere, our area, our backyard. And you have this country openly defying the United States with just flouting this thing, sending this tanker through with this illegal oil. And I'm proud of the president for seizing this and taking other actions to say enough's enough. You know, Maduro is a terrible person. He is a terrible person who has killed his own citizens, who has oppressed his own population, and who is willfully aiding and abetting the murder of American citizens through drugs and other activities. So I'm really glad the president's doing this.
And you say that Maduro in Venezuela is bringing in poison into the country. As you know, fentanyl comes in from Mexico. Would you be in support of similar action against Mexico?
Well, if you told me that Mexico was actually state sponsoring it, that's a different world. We know that's not happening, but what did the president do? The president put in place sanctions to deal with Mexico early on for not doing enough to stem the flow, and has encouraged them to deal with these cartels. And he also designated the illegal drug, the gangs that were doing this also as foreign terrorist actors. So you can deal very harshly with them. But the difference here is that you actually have with Venezuela government state-sponsored activity. In Mexico, you have lax law enforcement and a lot of other things. That's a different standard.